Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest highlighted to us is the impacted teeth in the upper maxillary jaw. Now, this is the 3D rendering. We can see that the upper right central incisor is rotated. There does not seem to be any tooth missing in the upper jaw. We've got the centrals, the laterals, the canines, and both the premolars and molars on both the sides. Now, we've got this protuberance on the maxillary arch apical to the central incisor, and we will show all the views to our kind doctor for their evaluation. Now, this is the axial view. On the axial view, we're going to take you from the occlusal aspect down to the apical aspect. Now, this is the occlusal aspect where you can see the central incisors, the laterals, and the canines. Now, as we move apically, we will be able to see that there is the presence of supernumerary teeth, which is impacting in the actual English sense, the and it is hindering the development and the positioning of the central incisors. Now, this is supernumerary tooth 1, which is present palatal to the upper left central incisor. This is the left side, this is the right side. And as we move further apically, we see that there is another supernumerary tooth which is placed in a horizontal fashion with the crown towards the palate and the apex towards the buccal cortical plate. Now, this is present in the midline between the two central incisors. Now, both these teeth are supernumerary in nature and they need to be extracted for the central incisors to fall into their normal positioning. Here you can clearly see that the supernumerary is in contact with the upper left central incisor. It is direct contact, whereas the supernumerary tooth number 2 is in direct contact with the central incisor in the upper right quadrant. Now, this is the coronal view. On the coronal view, we can see that these are fully developed teeth. They have complete apices have been closed. They have crown structures. They resemble incisor morphology, and we can see that they are in the upper premaxillary region. Now, this is the sagittal view. On the sagittal view, we will be able to see this is the central incisor on the left hand side. This is the tooth which is in contact with the central incisor. Here we can see that the PDL space of the central incisor has also been affected. As we are moving towards the midline, this is the second supernumerary tooth, and it is in close contact with the central incisor on the upper right quadrant. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.